coming from the joint first.
Yes.
And how to truly impact that right away is going to be much more effective. Even in the first session or two, you're going to get so much better outcome than what a typical first session is for most patients.
And we see this quite often with most other individuals, or they've seen many different providers for a certain condition that they can't necessarily heal.
Yeah.
And then you start thinking, okay, what are the other ways that you can heal? If you're not doing any specific training for certain specific structures, no wonder why it's not healing. No wonder why you're still having the same problem. And that goes into what we've said previously in other podcasts, where you can train/rehab joints different than ligaments, different than tendons, different than muscles. And each one needs a different stimuli and a progression of stimulation to rehab, to build up, just so you can prevent injuries, so you can increase your flexibility, range of motion.
And all of those should be targeted.
Yes.
You shouldn't forget some of those. A lot of people simply work muscle regions only. And like you said, we get to that point where muscle belly overcomes the tension away from joint and ligament and all those, and now we have injury.
And let's take it even a step further. And some of this we'll get into PODS, strength versus hypertrophy, and different ways that you can build up. But if you build up and if you have that strength, if you have the muscle mass, you don't have to keep building that up. You can almost put like a pin in it and maintain that to where that specific intensity, that specific exercise, you only have to do that maybe once every 2 to 3 weeks to keep the resources of those tissues, to keep that nervous system communication, those motor units.
If you just want to maintain.
If you want to maintain.
Of course, yeah.
But you have to get to that exact same intense stimuli, every 2 to 3 weeks. So if you want to ramp it up and let's say you want to keep the strength of your chest, but you want to work on other areas more so, schedule it out. Go and address, let's say, the chest. You want to keep that strength there, so you have to go back to that same intensity, that same like amount of weight you want to move, and put it on the calendar. That's the day that you're going to create that signal to that tissue to make sure it maintains as well. But you can work on other things outside that 2-3
And you had broken
range.
down in a table of when you should be training those per category. I think speed, power, strength, making sure what was the minimum.
Yes.
And I can't remember what pod that was, but.
And I didn't break it down. It was probably one of our earlier ones when we first started off.
That was helpful too.
episode
But
1,
I think
2, 3.
like you talked about doing a strength versus hypertrophy. We could maybe tackle that a little bit better.
Yeah, we'll go into that more specifically.
So Doc, most patients, for sure, when they have an issue, the first thing that they think about is either passive stretching or some type of simple stretching, static stretching mechanism. Do you want to just highlight why that can be actually more detrimental to their health, and what's some of the research behind that?
And we can go into static versus dynamic stretching with this as well. So passive versus active, someone controlling that range or those joints versus you actively controlling it. And we want to close that barrier between active and passive. And to preface some of this too, and especially if you're someone that's listening that's a gymnast or that had a lot of flexibility at one point in your life, but you don't do those same activities, you don't do the dance, cheerleading, gymnastics, and then now you're maybe a little bit more in a sedentary lifestyle, I'm sure you're noticing that you're either having more joint problems, more muscle aches, more muscle guarding. And that's because when you have that flexibility, when you're able to control that large range of motion, but then you don't utilize it, there's a difference between the brain-body connection, which opens up that premise to where you want to pretty much bring that passive range to active range, close that gap, and what are you actively able to control at that time? That is something that you can open up and utilize from there. So in terms of, let's say, a static stretching position. Now, in order to decrease the muscle guarding and to help with, which is known as like fascial plasticity, which more of it comes from the guarding signal of what's known as gamma motor tone, to where the body and the nervous system, that communication is able to like, okay, it's safe to move in this area. We're going to give it more range of motion. We're going to give it more area to where you can move that limb, that joint, that body part into. But that comes through nervous system communication via muscle contraction. So then we start looking at, okay, what are different ways that you can open up the range of motion and increase that brain to body connection. If you're going to a static stretching, so there's a bunch of different studies, anywhere from 2 to 31-minute holds can help that connection, and that's without even nervous system. But you need a good probably 4 to 8 week time frame to where you're going to start noticing, oh, I have a little bit more flexibility, or let's say I'm trying to bend down, touch my toes, but I can't necessarily, when I first start off, can't touch it. After each session, you start noticing your body is able to turn off some of the muscle guarding from the hamstrings, from the lower back, and it's okay, it's safe to move in here. But it's different from holding the stretch, let's say for 2 minutes, versus actively trying to bend down your tired shoes or bend down to pick up a soccer ball that was kicked to you without your back giving out. So there's the difference between the nervous system's communication down versus you just holding that position. Then that's the difference between dynamic and static, to where if you're holding that static stretch, try to contract or squeeze whatever area that you feel the most stretch, even if it's just a light contraction. Let's say, for example, you're trying to bend down, touch your toes. I'm noticing a lot of pull in my hamstrings or the muscles behind the thigh. From there, okay, maybe if my foot's in front of me, am I able to put pressure of my foot down to the ground, or just even squeeze my hamstring muscles, the muscles at the back of your leg? And from there, you're able to communicate that nervous system when everything is stretched. So when it goes into it over amount of reps and sessions, it's familiar with it. It turns off what's known as that gamma motor tone. It improves the flexibility. And that's just on a tissue level via communication through the muscle spindles and Golgi tendon organs to understand that tension, understand that stretch to get into that range. But let's say, for example, that's addressing the muscle belly specifically and a little bit on the tendinous aspect. Again, going back to the communication between joints and brain, if we want to start the rehab process, that's where workspaces, joints, working your joints, doing controlled articular rotations or cars come into play. So you would first want to start active mobility. For example, for those people that are not watching on the video, shoulder workspace, shoulder cars. We want to move this shoulder, this ball and socket joint, independently from anything else. So it's controlling, making the arm straight, making the torso straight, and then we're going through the biggest range of motion you possibly can, sharp, pain-free. If you have that diminished angle, go around it, but with that, we're able to communicate to the end ranges of that line of tightness to give the body in that signal more familiarity, thus increase range of motion. And also for cars and joints, it's getting that joint through the biggest range of motion to help for the synovial fluid exchange on the edges. It also helps for blood flow on the edges as well. So you have blood flow, you have joint fluid, synovial fluid, you have the brain's communication. It accelerates the tissue healing. And then it subsequently turns off some of the muscle guarding, thus increase range of motion from there. So 2 things to kind of follow back up. Moving each joint specifically through the fullest range of motion targets the joints, brain communication. And then 2, if you're going into a static stretch, you want to hold anywhere from 2 to 31 minutes a day. Of that time, it doesn't have to be 2 minutes straight or 31 minutes straight. Maybe it's 30 seconds, but 4 times. And that's maybe 1 session. More sessions, the better the communication is, the faster the results you're going to have from there. But you would stretch and then apply a contraction or squeeze the muscle bellies where you're stretching specifically. So you get the muscles and then you get the joints from there.
Yeah. And I know you have a lot of information here about just how joint capsule integrity can improve mobility, but I liked that when the research proves that
there's a lot of studies.
The way that the joint is so connected to proprioception, mechanoreception, neuromuscular reflex, postural control, the second you start training for joint is the second you're changing so many more things other than just that tension in the tissue. And I think that's what people miss. That's what they forget. And maybe they just don't know too.
That's definitely
that's probably a lot of it. But
yes,
one right here showed that cortical remapping of joint control is trainable via mechanoreceptor input, and decline in mechanoreceptors reduce functional ROM in degenerative joints.
Range of motion.
And lastly, then joint capsule stimulation was what can actually enhance neuromuscular reflex, postural control, mechanoreception, and proprioceptions. You just take a look at just all the things that a lot of patients are already dealing with. Just simple joint capsule stimulation can enhance all four of those things that they deal with within a degenerative or arthritic joint.
Oh, yes.
And that's through cars, even simply. You haven't even got to all the other things that we can have you do with a patient too. But workspaces, especially, versus maybe a static stretch is where we want to shift our mindset to.
Yes. And now let's get another principle of what are different ways that you can address the nervous system's communication to that tissue on an electrical standpoint.
Yeah, yes.
So that's where you can get into a couple different things. Let's say, I like this example because a lot of people can relate to this. I have popping, cracking in certain parts. Is it okay? Is there anything wrong with that? I get that question often. Depends on where it's at. Spine's different from extremities and there's different parts and aspects with that. So let's say I'm going through neck or cervical workspace where I'm moving my neck through the biggest circle I possibly can. Maybe I notice a couple pops, cracks, releases. One, is it painful? If not, I'm really not concerned. If it creates a spasm after the pop crack and then it forces everything to tighten up, then you might want to be aware of that. There's different ways that you can open up that range of motion. From there, we'll go see a chiropractor, a PT, and do this as an assessment portion throughout your care, if we will. But the main premise is we're getting gas exchange into the joints, and then the popping, cracking, release is almost, so the cavitation is almost gas is coming in and that gets released to a certain extent. Doc, do you want to explain that aspect of gas coming in and out of the joints?
Are you talking about the tribonucleation?
Yeah.
Oh, okay, yeah. And we had a similar idea of what happened in the joint long ago. We were expecting that when the pressure gradient changed with the space gap of a joint, it was basically gases or bubbles releasing.
Yes.
And we found that in a way it is, but it's actually the reformation of the bubble after the space has been emptied is what gains us more, we'll call it space in the joint after an adjustment. And the formation of those bubbles into that empty space again causes a lot of noise. And so it's the reformation of the bubbles after the space is emptied that gives us this small window gap, which helps for range of motion. It can stimulate nervous system upregulation, decrease pain, all these things that we have now theorized. But the noise is actually through the formation of bubbles, not the popping or gas leaving of bubbles in a way. But that has been a pretty helpful change in how we understand the joints in the body, the synovial joints especially.
Yes.
And Dr. Gregory Kotrick was the gentleman behind that study, who's a chiropractor in Canada. And so it was cool. It was really cool to see that we now have really good research to just show what we do as chiropractors.